My name is Chris Tarver. Good afternoon, and I'm here on behalf of this awesome team from City of Hope to talk to you about our solution for autonomy and flexibility improvement for nurses. It's called Trading Spaces. So the story, we have two nurses. Deb is an inpatient nurse in the ICU who recently graduated with her MSN and is asking herself, what's next? We have an ambulatory nurse, Nancy, who left inpatient a couple years ago, but is missing that contact that you get from a longer-term inpatient and the different skill sets. They both want to expand their skills and they feel stuck in their roles. It's leading to burnout and decreased job satisfaction. They're thinking about leaving the organization or perhaps leaving the profession altogether. So how big is this problem? Well, spurred on by COVID, 500,000 nurses are expected to leave our profession by the end of the year. This will balloon the nursing shortage to 1.1 million nurses by the end of 2022. We're offering trading spaces. That's hope for nurses. The average cost of one nurse turnover is $40,000. If Deb and Nancy both leave, that's $80,000 cost. If we have 10 trading spaces dyads, which is 20 nurses, we could save the hospital $800,000. If every hospital in the US was able to replicate this model, it could save almost $5 billion in our industry. So what is our solution? Trading Spaces is a dual role program. We would have a Trading Spaces online hub where nurses could apply to be in the dyads. They would have access to things like skills, resources, and well-being. We would have orientation and competency checkoff. We'd have a part-time Trading Spaces coordinator, and we do data collection through an evidence-based thriving scale and job satisfaction scale. So what does a one-year annual cycle look like for Trading Spaces? In January, we would recruit and select the dyads. In February, they would have their orientation and sign a one-year commitment to the program. In March, they would start working in the dyad. So that's two nurses sharing two jobs. So you do half of a week in one job, half of a week in another, as an example. In June, September, and December, we would do data collection, and every January, we would start over again. In the competitive space, in literature for dual roles, really what you see is hospitals and academia. So nurses are shared between a hospital and a university to teach nurses, like nursing faculty, adjunct faculty. Our solution, Trading Spaces, really the competitors right now for a nurse to expand their role or do something else is they would go part-time or per diem, they would become a traveler, they would have a second job, or they could leave the profession altogether. So Trading Spaces offers the benefits of full-time status, longevity, because you get to stay at your organization, diversifying the skill sets, succession planning, and being employed as a nurse. The other solutions offer some of those benefits, but not all. And leaving the profession altogether offers none of the benefits. So who are our customers? They're administrators at US hospitals who want to stop the leaving of nurses. They want to keep their nurses, and they want to have nurses who are satisfied in their jobs. If we could save the 10 dyads, 20 nurses from City of Hope, it would be a net cost savings of just over $700,000. If this could be replicated across healthcare organizations in the US, it would be over $4 billion. The users of Trading Spaces are nurses and nurse practitioners. We honor their experience and their loyalty to the organization by enrolling them in the program. So our one-year budget, we are asking for $88,130 to make Trading Spaces a reality. This would cover the cost of the Trading Spaces hub, our marketing, a coordinator, a part-time coordinator, the training, data analysis, and dissemination. In year 2 and year 3, the costs are pretty similar, except for the one-time startup cost for the hub. So this slide shows our line item for the 1 year. A few things I wanted to call out. The orientation budget is about $3,400. For the labor cost of our program, it would be the part-time Trading Spaces coordinator, which is 19.6% of the entire ask. In the in-kind support, the hospital, City of Hope, we are also contributing. We're covering the cost of any cross-training that might be needed by the dyads and positions like my own who would help the program come to fruition, and our nurse researcher, people like that. So how are we going to sustain trading places? Well, at City of Hope, we have a brand new position called Nursing Workforce Program Director, which we have filled. This is a full-time master's prepared nurse who will work on strengthening our workforce and focusing on engagement. We have a trading spaces coordinator who would be 4 hours per week and would be a mentor to the dyads. We have a PhD nurse researcher who has published much. She is versed in analytics and metrics, and she would be a mentor to manuscripts so we could disseminate our findings. And we have a strong education team and education infrastructure. They would support the competencies, orientation. They would be frontline support for the dyads. And we have an online competency-based system so we can make sure everybody has the skills they need and they're being checked off. We feel we've assembled a dream team. This interprofessional team includes myself and our executive sponsor, Sarah Caeza, who is very used to innovative implementations. We have 2 project managers, Amy and Sarah. We have our nurse PhD researcher, Janine. We have Erin, who's our nurse practitioner leader, and Eddie, who's our HR business partner and will liaison with the union. So in closing, in a multiverse world, Deb and Nancy did not leave the organization. They stayed and participated in the Trading Spaces dyad. If we could imagine eliminating turnover for nurses, it's 10% right now at City of Hope. We could save 160 nurses. That's $6 million to the organization. An industry could save 500,000 nurses. What if they never left? We could increase job satisfaction, engagement, make hospitals employers of choice, decrease burnout, turnover, and vacancy. Thank you to all the sponsors for Nurse Hack for Health Pitch-A-Thon, and we are happy to answer your questions.